My name is Rita Tete, and I am presenting on the causes of hepatitis B. Hepatitis B infection is caused by the hepatitis B virus, which is the HBV. The virus is passed from person to person through blood, semen, or other body fluids. The common ways hepatitis B virus is transmitted include sexual contact, sharing of needles, accidental needle sticks, mother-to-child transmission through delivery or breastfeeding. On the other side is the hepatitis B virus, and it is labeled. We have the polymerase, the DNA, the core, the outer lipid envelope, and the HBsAg. Hepatitis is a general term referring to inflammation of the liver. Under the causes, we also have the infectious and the non-infectious. Under the infectious, we have viral, bacterial, fungal, and parasitic. Under the non-infectious, we have alcohol, drugs, autoimmune, metabolic diseases. On the left side, we have some of the causes with pictures. We have the hereditary, the drugs, the viruses, alcohol abuse, and the IV drug use. On the right side, we have the liver, and then the stages. We have the chronic hepatitis, the cirrhosis, and the hepatocellular carcinoma with cirrhosis. Gram stain. According to eHealthMe, there is no gram stain positive reported by people who have been diagnosed with hepatitis B yet. CDC also made us understand that gram-positive bacteria are found normally on the skin, such as Staphylococcus epidermidis or Staphylococcus aureus are the most common bacteria contaminants of blood products. Gram-negative bacteria can cause infections including pneumonia, bloodstream infections, wound or surgical site infections, and meningitis. So with all these explanations, it helps us understand that hepatitis B is a gram stain free because it is a virus.
Hello, my name is Nicole Dunford, and I will be talking about the reservoir for hepatitis B. The reservoir is the principal habitat where a specific infectious agent lives and multiplies. Humans are the usual reservoir for hepatitis B. The human carrier can be asymptomatic for a prolonged period of time. Being asymptomatic means that you are still a carrier of the virus, but you are showing no symptoms. Chimpanzees are susceptible, but it is very rare for them to be a reservoir for hepatitis B. No other animal in nature has been found to have the virus, and there are no non-living reservoirs, which means there is nothing in the environment that can be a contaminant or a virus carrier for hepatitis B.
Hello, my name is Tess Rogers, and I will be presenting the signs, symptoms, and transmission of hepatitis B. Signs are different from symptoms. A sign is objective evidence of disease. It is something that can be seen as what the doctor sees to his or her patient. Some of the signs of hepatitis B are dark urine, clay-colored bowel movements, jaundice. Jaundice is the yellowing of the skin and the eyes. This is a picture of someone with jaundice. Notice that there is yellowish tinge in the skin and the sclerae. Sclerae is the white part of the eye. This happens when there is too much bilirubin buildup in our system because the liver is damaged and it doesn't metabolize bilirubin the way it should be. A symptom is a subjective evidence of disease. It is a feeling people that can be seen. It's what a patient or someone experiences. Some of the symptoms that associate with hepatitis B are fever, joint pain, fatigue, loss of appetite, nausea, vomiting, abdominal pain. However, the symptoms of hepatitis B depend on whether a person has an acute or chronic hepatitis B infection. And most people who have an acute hepatitis B infection don't even realize they do because they have no symptoms. Moving along with transmission. Transmission of hepatitis B. Hepatitis B is transmitted when blood, semen, or any other bodily fluid of an infected person is transferred to a person who is not infected. It can be from a puncture to the skin, a shared needle, or an exchange of bodily fluids. It can also be transmitted from mother to baby during birth if the mother is infected. It can even be spread through sharing household items such as toothbrushes and razors. Unsafe medical practices such as reusing medical equipment can also lead to HBV infection.
Hi, my name is Morgan Casper, and I will be going over prevention control, treatment, the history of hepatitis B, and then also some interesting facts. So for prevention control, one of the most important things to do is always know the HBV status of any sexual partner, avoid illicit drugs, or otherwise use sterile needles. Be very cautious about where you get body piercings and tattoos. Make sure it is somewhere that has a good reputation. The best way to prevent getting hepatitis B is getting the vaccine. It is typically given as 3 or 4 injections over a period of 6 months. The first dose is recommended within 24 hours of birth and is injected into the thigh. This vaccine is a subunit conjugate vaccine, which means it is like a whole cell inactivated vaccine with no live components. It only contains pieces of the pathogens they protect against. The isolated protein from the pathogen is used to invoke a protective response from the immune system. Treatment includes antiviral medication. If you get the virus, you can get the hepatitis B vaccine and a shot of hepatitis B immune globulin within 2 weeks to lessen the symptoms and also the spread of the virus. It's very important to avoid alcohol and acetaminophen if you have the virus. And the very last resort is a liver transplant if your cirrhosis is severe enough. In the 1950s, Burke Bloomberg was studying the genetics of disease susceptibility and traveled around the world to analyze blood samples. He studied hemophiliac patients who had received multiple blood transfusions. As these patients received blood from donors, their immune system produced antibodies against foreign antigens. Bloomberg noticed a foreign pathogen in an Australian patient and named it the Australian antigen. In 1967, he recognized this antigen was the cause of hepatitis B. And in 1969, he created the hepatitis B vaccine. There are some interesting facts about hepatitis B. One of them is 90% of infants who acquire hepatitis B from their mothers will be chronically infected, which means that their liver will get progressively worse throughout their lives. There's an epidemic in China and some parts of Asia. 8 to 10% of the population is chronically infected, and most become infected as a child. The majority of people with hepatitis B don't even know that they have the virus. Approximately 3,000 people in the United States and 600,000 people worldwide die from this virus every single year. And then here's also a list of references that we use to create our presentation.